Good afternoon to all of the audience to looking for this speech. My name is Thiban I'm a Bachelor Horns Physiotherapy, which is as a just fresh graduate from INTI University Nilai. So today I'm going to share a special topic about our Little Angel Center, which is mostly the students are here, which is Autism Spectrum Disorder (ASD). The Albert Einstein say everyone is a genius. So if you are judged a fish on the ability to climb a tree is a while is a whole life believing that is a stupid. So without regarding, we are moving forward for the next. So for the learning outcomes, which is at the end of the session, you will able to describe the clinical features of autism spectrum disorder and describe the common medical management of autism spectrum disorder. And the last is to know what are the basic assessment and physiotherapy management in children with autism spectrum disorder. So most of the family members or the outside people, which is they are really didn't notice about the clinical features or known as sign and symptom of autism, and then even though they don't know what to do the next step, they are scared you need to do a surgery or anything. So I will explain and briefly talking about the sign and symptom, and then what you should do the next step for the medical management if you see a doctor, and following by coming to my part is the physiotherapy assessment and management as well in autism. So moving forward for the briefing about the autism, if autism spectrum disorder is a neurodevelopment disorder which a person present with a range of impairment in social interaction, verbal and non-verbal communication, restricted and repetitive pattern of behavior, interests or activities. So what is neurodevelopment disorder is the condition that affect the brain of the child or the baby. They have a range of mild impairment and then allowing to affected to live fairly from normal life. So severe disorder that require lifelong care, example of the neurodevelopment disorders such as ADHD, speech and language disorder are fully affected. So moving forward to the next slide. Autism spectrum disorder, the prevalence as the stated in the recent research, approximation in 1 in 54 children is diagnosed with uh, autism. And it's coming by CDC stated in the research on 2022. In Malaysia, approximately 1 in 625 individual stated by Minister of Health on 2014. Over 300,000 individuals living with autism spectrum disorder in Malaysia. So, as you can see the picture for the stated in my slide, for every girl identified as the autism spectrum disorder, there is a 4 boys were identified. White and black children were 1.2 times more likely. So to be identified the autism spectrum disorder than Hispanic children. So for the next slide, autism spectrum disorder, what are mainly causes or known as etiology? So as we found that there is a no clear causes or etiology got diagnosed for autism spectrum disorder. There's no specific genes, and there is a point are stated that may be presented of features of some rare genetic disorder, example, Fragile X syndrome, which is problem including learning disability and cognitive impairment. So mostly the child of children they're having learning disability and cognitive impairment if the Fragile X syndrome is affected. So possibilities that triggers these causes might be is being born prematurely before 35 weeks of pregnancy might be have these common causes, and being exposed in womb to alcohol or certain medications such as example of sodium valproate, and non-conclusive evidence of pollution or maternal infection. So for the first risk factor that highlighted here is genetics. Among the siblings, example I was giving here, among the siblings, if one child have an autism spectrum disorder, the other child have a 31 percentage of risk. The next point is in identical twins, if one child have autism spectrum disorder, the other will have chance of autism spectrum disorder by 36 to 95 percentage. For non-identical twins, if one child have autism, the other child have affected by 31 percentage. So meaning if the child have a siblings, there is a possibility having another child autism. Might be no percentage is very less, but there is a possibility having another child with the autism. So this is a risk factor for the autism. Moving forward, the next risk factor is prenatal period and perinatal period. So what is prenatal? Some of them don't know is prenatal is before birth and prenatal is after immediately the childbirth. So for the before birth, the prenatal period is maternal or perinatal age where fluoric acid or high fluoride dose, which is they're taking this medicine or anything that causes this, they are having the risk factor. Gestation diabetes, gestational bleeding, multiple birth, maternal birth abortion, and then for the after immediately child is born is the premature birth, breech presentation happen, planned castenary section, pre-explasia is lead to bleeding, vomiting and bleeding, infection and stress during pregnancy. This is a common risk factor before birth and after birth for the autism spectrum disorder. Moving to the next, neonatal, as you saw, is a newborn, which is they have a prematurity less than 32 weeks, low weight, low birth weight, which is they have a less than 2,500 GMS, low upgrade score. Upgrade score is something that we need to check, not only physio, but then normally upgrade score they're checking the movement of head, the common symptom as a child need to do. If they're less than 6 or 7 score in 1 minute, there is a possibility this score. Hyperbilirubinemia, which is bilirubinemia is a condition which there is a too much bilirubin in the baby blood. When the red blood cell down to subtype called the bilirubin. And then the next was birth defect, and then the last one is poor condition at the birth, like apoxia, transfer to the special care. And then the last point of the risk factor, environmental toxic, which is placental is a chemical compound, the meaning of that. Solvent is a liquid, hair pollens, and then the chemical make more plastic, which is pellets, and toxic wet site, heavy metals. So the last risk factor as a common but not so common, but this is the two common things: vaccine and nutrition. Measles vaccine, live in measles virus, the thermosol called as a mercury-based prevention used in vaccine. And then the another one is nutrition, which is they have a lack of D, vitamin D, and folic acid. Clinical features for the autism. So markedly abnormal or impaired development in SI. Previously, I was mentioning this in the different slide. Social interaction, communication, presence of stereotype and unusual interest. So intellectual function may vary. If you can see the picture on the right side, the dark blue is a core clinical features, which is a very major thing in the autism child, which is their social communication is a very affected for them. And then go to repetitive behavior. So the one thing they will keep on doing, which is for us is like what is he doing, but then for them is something is a symptom. He will doing the behavior keep on doing even though it's nothing to burden them. Same goes to the social communication. There will some kids that will not talking. They are making sound. They will make something noise or they follow some of the people noise, keep repeating, doing the thing. repetitively. So for the next one, associate neurological symptom, which is the neuron, the nerves of the brain cell, brain nerves is affected, which is they have anxiety. The mood will disturb all the time. Sleeping also affected for them. They need to have attention from the people. They make an intention. Hyperactivity. They will do some of the child do the hyper child, so they have a hyperactivity. They won't feel tiredness compared to normal child doing the activity. Language disability, as the speech with delay means everything is affected for them. Sometimes the language they don't understand what we are talking unless they are teaching. Some children will understand, but some children don't really understand. Seizure will affect it for them, and then they have a tantrum for them. They know how to tantrum. They have to do the tantrum, have an aggressive behavior also, and then they will do the self injury. So the last one is a physical symptom, which is very minimal common symptom for this, which is that there's immune dysfunction and sensory dysfunction. Moving to the next is the same clinical presentation. So they have an impaired reciprocal social interaction and communication. Their own interaction with the people or the same age of children, their own communication also affected for them, as I mentioned briefly before this. Restrictive and repetitive stereotypical pattern of behavior. As I mentioned before, they are doing the same repetitive behavior, so very bad in certain skill. Doesn't matter autism children, they are not all not the good, but they are good in certain things, which is they are very specialist. They are because they are like things means they will definitely do the better skill. Abnormal pair, little symbolic play, distributing rigidity, preoccupation with the part of object. So some of the parts of the object or play things, the toys, they might be not okay because there's some of the sensory issue. They have a motor issues that they're not really. Some children, yes, they like the toys. They every day or every time they will play, even though the object is considered already boring for them. So as you can see in the picture beside, autism early sign in newborn, which is they can many of the parents or people didn't know or notice about this. As you can see, number one, unusual visual fixation. So if you're giving a toys to the normal kid and the special kid with the autism, you see what is the difference. Is it that child is doing or not, and with the appropriate examination with the giving object that they are like. If the things is not really, they are not really doing well as a normal kids, or maybe need to take time, they need to learn also. Things are not really okay, you feel like something's going on, okay, you proceed to next. Abnormal repetitive behavior, do you giving a toys, let's say a car, the car should be moving the road, I mean the floor, but then the child is using the toys with a different method way. Same goes to other things, other toys or anything. Their behavior is changing. I mean, response giving to the toys or something they are doing opposite. So something is you can notice on this, and a lack of age appropriate sound development. So this one, most of the children or child, they have a delay in the speech. So they have a giving a weird thing sound like music things, or they will copy the video going on, but then if things stick on their mind, they were doing that all the time. So the common thing, all the babies or children will say mama papa. So this major thing that they until the certain age they still cannot say, there is some problem on their child. So the fourth, delay intentional communication. So they won't focus on you even though you're calling their name. They no focus or eyes contact is literally don't have with you. So neural facial tones are decreased effort to capture and gain pain. Let's say you're showing something, you're pointing something, they never do or never follow. Eyes contact literally don't have. and there is facial expression also is literally abnormal. It's nothing, especially they are expressed with a different kind of facial. Decreased interest in interaction. So let's say the things that don't like or something they will throw away, or they have a object, the person giving an object to them, but then the object they don't want to share, or they want to hide with something or some other place, and they are doing the toys or playing the toys. They don't want to interaction with the people that, I mean the people that are giving, let's say the parents, they don't want, or the new people and they like it. Sure, they don't want, because they want to secure the toys from the people. So that's a common sign and symptom or clinical features that you can identify. If there is everything they are noticed, as soon as possible, bring to the clinic or hospital, refer to doctor and get the proper diagnosis. Most of the parents are literally don't want to go to hospital or clinic, even though nowadays generation they're still scared. Children might be have a different, or maybe they have a late delay, something like that, but it's not. If you're better early as possible, is early intervention for your child. Social issue. So they have, does not respond to name by 12 months of the age. So when you calling your child by giving the name, but they didn't look at you or didn't respond, there's something problem. As I say, avoid eyes contact just now. So eyes contact literally don't have. So you need to notice on that. Prefer to play alone. As I mentioned just now, they don't want to interaction with the people. Either they are same age of children, or their mother, father, or siblings. They won't play toys or anything with the sharing. They totally don't like sharings. Does not share interest with others. So there's no up and down, like they are like more on these people, so they will play. There's no for them. Only interact to achieve. So in case they want to something that they cannot achieve from their self, they will definitely pick you or call you by bring the hand. They want something from you to get. Once get, they will don't giving any response or interaction with you. Once they get their achievement from you, they will definitely play with that toys lah. Have an improper facial expression, as I mentioned before. Have avoids or resists physical contact. So they don't like people touching them, and then literally the touching sensation or anything with the people, like they have a skin problem or sensitive issue, which is the water or anything touching the skin, they have a very sensitive to that. So this is the most of the common symptom that can notice from the autism children. For next, communication. So communication which are various. So there is a delay speech and language. This is the most common which is affected in the autism spectrum disorder. Impaired ability to initiate or sustain conversation with others. They cannot prolong the long sentence. They only can one or two if the child is okay a bit, but then they cannot prolong a long conversation or listening to them longer conversation. They are only can listen one word from you to like something you instruct, but then they cannot listening to all the long conversation. And the third point, echologia, which is repeat words or present praise over or over. So let's say they are like one of the theme or something, the object or TV show, a cartoon, or anything they like. They'll keep on repetitively saying every day, all the time, either they're angry, crying, or happy. They will say abnormal word things like suddenly you are talking, they are playing or toys, but then they're talking about food. Food of, like they say banana or something, they say animal thing, kangaroo or anything that not relevant to the currently they're doing. So they are repeatedly saying that. So that's the meaning. Reverse pronouns. They want to say you, but then they pronounce of I. Give unrelated answer to the questions. Does not respond to the pointing. Uses few or no gesture. Does not wave to goodbye. Say wave bye bye or goodbye. They don't want to say anything like bye bye. So just following people or the opposite, they are only saying, but then they literally not understand what is meaning of that. And talking in the flat, robot like or sing song voice. So they will do imitation, but then they will like it or not. If they don't like it, they won't do, or they don't understand it. Does not pretend in play or imitation. Example like does not pretend to feed a doll. Does not understand a joke, sarcasm, or teasing. They literally don't understand there's a joke is going on. So they are this child of the autism, they're having this kind of situation. So yes, for the next is communication with the autism. If you can see this picture, they are saying the green color shirt is a person, the child is a normal child. They say, hi, how are you? The opposite one, the green color, talking to the red color pants. They was thinking what is going on. If you see the white color dialogues, they are thinking is I don't understand what to say, Raz. They don't know literally what to say. They don't understand what they are trying to say. Then they say they need more time for process to their mind. What is the information they're asking? And then the voice is too loud. So for autism, they have a even the teeny sound of the from the far away from them, they can literally listen. Compared to normal person, child or human, they don't have the sense of the tone of the sound is going on. But then for autism, God have created this that they can listen. A small teeny voice they can listen from the far away. So when you're talking to them, for them it's very loud, even though you didn't raise your voice. And yeah, this is basically they don't maintain the eyes contact as I can. They cannot interact the body language. They're like shaking around, cannot stand for the place of longer. And then they're not comfortable moving body by something they're saying bye bye anything. So this is a communication with the autism. There's a lot of barriers going on, which is they are literally affected. They have a reply with some other error communications. So for the next topic, the following is unusual interest and behavior. Line up toys or other object that play with the toys the same way every time. Like the part of object is very organized, get upset by minor changes. Flat hands, rock body, or spin surf in circle. So line up on other subject is like line up toys. They make it the cars. Let's say the car. They make a like, literally we normal way we can say OCD. They don't like the object is moving, not organized. They want to organize the toys. So they are literally don't like the toys is literally moving. For the other explanation is they don't like someone disturbing their object or game they're doing. So let's say you want to willing to help to your child, they are playing the game. They don't like they will either they do again or even though you're helping to the part object you put, they will take again the object then they put. So for them it's something that satisfaction for them. So they don't like you touching the toys, everything. And even you're changing the things put away somewhere else, they will angry, crying, or they're upset. So yes, for the next thing is protodeclarative, which is a primitive speech act used to establish social interaction with the direct caregiver, attention to an object or action or entity. It's a refer to the pro-declarative because the directed attention to the object. So action entirely by child act as a comment in the communicative exchange. So this is a make a several gesture form including pointing to, showing, or giving an object. So the gesture may or may not accompany by reciprocation, and then they appear in typical development by children between 8 to 9 months of the age. It is the thought of demonstration of a shift cognitive development in the use of reflex the child conscious intent to the initial social interaction, establishing joint attention or object action entitled a caregiver. This is the meaning of proto-declarative. So the main one is the pointing is expression by emotion regarding or drawing attention to get an object. Pointing an object or event which is pleasant them, a cartoon or example, the glazing between the object and adult by smiling or pointing motion. So literally showing emotional by getting an object or finding an object. The second one, proto-imperative pointing. So they are requesting or initiating some action related to the option. So the object is they are literally doing the back, guiding a adult hand to reach toy to out of the reach to point. So they want to something to reach out, or they want it's still a new things for them. So they want to someone older than them or someone which is they didn't they are no. So they want to do back and then they will follow back. It's because they literally don't know to explore what is going on in the new object. So coming for the summary, if you can see the summary, this summary is as about if you can see the total sum before I'm going to physiotherapy part. They have a different display indifferent, so they don't show what is male and female gender wise. They literally don't know. So join in only if adults instance of assist, and then one side interaction only, no eye contact. Variety is the spice of life. Indicate needs by using an adult's hand. So they want to something they cannot speak or cannot show because they are delay in speech. So they will bring someone adult to show to certain. Does not play with other children. They won't harmful or anything with the other children, but then they are don't interact with the other children. They won't scold or they won't getting anything with harmless, but they are keep away and talks inconstantly about the one topic. So they are, as I mentioned, they are repeat the same thing. Lack of creative to pretend play, bizarre behavior, improper laughing and giggling, colleague copies word like a parrot, like to spin object, can do something very well, very quickly, but not talks involving social understanding. Define or clinical symptom and the medical management that we can see. Thank you for watching for my presentation video for today. I hope you guys understand. If you don't understand, you can give a comment on the below. If you guys want to know about these special kids topics or something knowledge you want to gain or want to share to other people, or you want to know about in case your family members having anything for the special kids, you can definitely following this YouTube channel. Please give a subscription button and give a like button for the videos you want to like, and give a notification bell also, so you can know what's upcoming videos are coming in this YouTube channel. So thank you for in case you are doing this thing. Have a blessed day.